Good evening.
Good evening. Can I see your candidate number, please?
Okay, this is my candidate number.
399. Okay. You read the instruction outside, right?
Right.
Yeah, this is your patient. Now you can proceed. Start.
Hello?
Hello?
My name is Muhammad. I'm one of the surgical doctor. May confirm your name and age for me, please?
My name is John. I'm 56 years old.
Nice to meet you, Mr. John. Today I will be your doctor. Is that all right?
Yeah, that's okay, Dr. S.
How can I help you today?
I had an episode of seizure, doctor, just 1 hour ago. That's why I came to the hospital.
Really sorry to hear that, Mr. John. Is this the first episode?
No, I had a couple of episodes before. I'm known case of epilepsy.
Before this episode, Mr. John, did you experience any visual disturbance or hearing an abnormal sound?
Yes, I usually see flashing lights before the episode.
During the episode, did you notice that whole of your body shaking or some part of your body?
I can't answer this question, doctor, because I was unconscious, so I can't answer this question.
Okay, I can see. Okay, Mr. John, is there anyone witness the event?
Yes, my wife was there, and
how she described it?
She describes it as I was shaking. All my body was shaking. I wasn't conscious.
Okay, Mr. John, did you hit your head?
Yeah, I did hit my head with the wall, and I also bite my tongue.
Okay, did you wait on yourself?
No, I didn't.
Okay, Mr. John, after this episode, did you feel any weakness or numbness in your lower limb?
I didn't feel any weakness, but I felt generally tired.
Can see. How about your health being recently, Mr. John?
It's okay, doctor. Nothing significant, except these episodes of seizure are getting worse and worse. They became more frequent.
Don't worry, we will take care of you, Mr. John. Did you notice any unintentional weight loss or generalized tiredness?
I didn't notice any unintentional weight loss, no. But as I told you already, I feel tired most of the time, yes.
I can see. Is there any vomiting?
No, I don't have any vomiting, no.
Did you get trauma in your head, Mr. John?
Yes, I had trauma 6 years ago, and one of the doctors told me this trauma is the cause of my epilepsy.
Do you have a fever?
No, I don't have fever, no.
Any neck stiffness or change in color of your skin?
No, I don't have any neck stiffness or changing in color of my skin, no.
Mr. John, did you experience any increased sensitive to the light?
No, I didn't experience any increased sensitive to the light, no.
You said that you have similar condition previously.
Yeah, it's an episode of epilepsy, doctor. As you know, it's epilepsy, so it does come frequently. Yes, I had a couple of seizures before.
I can see. What type of medication that you take for epilepsy, Mr. John?
I take valproic acid. Yes, that's the most important one. And another drug, I don't remember the name at the moment.
Okay, I can see. Did you diagnose by other medical condition?
Yes, I have diabetes. And I take metformin for the diabetes.
Can see. Is there anyone in your family had a similar condition, Mr. John?
No, none of my family had epilepsy, no.
Did you have any allergy from any medication?
No, I don't have any allergy, no.
Okay, Mr. John, now I want to ask you a personal question. Is that all right?
Yeah, that's okay. You can ask personal questions, no worries.
What do you do for a living, Mr. John?
I'm a teacher.
Nice to hear that. Who live with you?
My wife and my son.
Do you smoke?
Yes, I smoke around 5 cigarettes. 5 cigarettes a day, you can say.
Do you drink alcohol?
Yes.
How many?
But on the weekend, though, like occasionally on the weekend, social drink.
How many units per week, Mr. John?
You can say around 10 units a week.
Can say. Did you have any difficulty with steering, Mr. John?
It's fine, but I usually have that fear that I may have an episode while I'm taking the stairs. But otherwise, it's okay. I can use the stairs easily.
Okay, Mr. John. What do you think the cause is?
I think it's another episode of the epilepsy that I already diagnosed with.
Is there anything that you're most concerned about?
Just like, yeah, I'm concerned these episodes are getting more frequent now and interfering with my quality of life.
Don't worry, Mr. John. We will take care of you.
Yeah, I hope so, doctor.
Is there anything that you want for me to do for you today?
I think that's all. And I hope that like you try to figure out what's going wrong and try to fix me. I don't want to experience this unfortunate event more frequently like what's happening right now.
Okay, we're gonna try to fix that, Mr. John. Okay, Mr. John. Is there any chest pain or shortness of breath?
No, I don't have any chest pain or shortness of breath. No.
Any tummy pain or difficulty in urination?
No, I don't have these. No.
Okay, Mr. John. We have reached our end of question. You have been so cooperative. If you have any question for me?
No, I don't have any question. No, that's all.
Thank you so much, Mr. John.
Thank you, doctor. Okay, if you can present your patient, please.
Took history from this gentleman, 65 years old, known case of diabetes and epilepsy. 6 years ago. He takes metformin for diabetes and valproic acid for epilepsy.
Okay.
He came complaining of seizure 1 hour ago.
Okay.
He has an episode of aura, and during the episode, he's shaking whole of his body. His wife described that he's like tonic-clonic movement.
All right. So, doctor, from what you're saying now, that's all right. That's all right. So you have a 60-something-year-old man presented with seizure. He's diabetic and epileptic, and he had this epilepsy after the accident he had or the injury he had 6 years ago.
Yes.
So what do you think?
Yes.
What do you think the most appropriate diagnosis?
My main diagnosis, epilepsy.
Epilepsy. So this is another seizure, and he's known as epileptic patient. Okay. What else you need to consider and you need to differentiate? What's your differential diagnosis?
I will consider brain tumor.
Okay.
Infection as meningitis or encephalitis. Also, I will consider stroke and multiple sclerosis, transient ischemic attack.
Transient ischemic attack. Okay. And as do you want to consider anything else regarding electrolytes?
Okay. I will consider an metabolic problem as hypoglycemia or hypokalemia.
Okay. And what else regarding the electrolytes?
Hypocalcemia and hypomagnesemia and hyponatremia.
Yeah. Okay. And how are you going to investigate this patient?
First of all, I will start by request an electric encephalogram. Is the most important. Then I will consider blood investigation as full blood count to estimate hemoglobin and white blood cell. Also, I will consider serum calcium, serum phosphate, serum magnesium, and urea and electrolyte. And I will consider an CT head brain.
Okay.
And MRI.
Why are you considering?
And I will consider also lumbar puncture to exclude any cause of meningitis.
Okay. Before you do any lumbar puncture, what's the most important thing that you need to check?
I need to check the intracranial pressure because lumbar puncture may cause herniation or coning.
Herniation if the patient has increased intracranial pressure, right? Okay.
Yes.
And how you going to treat this patient, doctor?
First of all, I will discuss my management with a multidisciplinary team involving neurosurgeon, general surgeon, and anesthesia consultant.
Okay. And what else? Who else?
And
Neurologist.
benzodiazepine.
And neurologist.
Yes, neurosurgeon and neurologist.
Yes. Okay. And okay, you can continue now. I'm listening.
And I will consider medication as benzodiazepine, as diazepam 10 to 20 milligram IV, or lorazepam 4 to 8 milligram. Also, I will consider phenytoin 18 to 20 milligram per kg IV. Okay. Then I will monitor the patient vital sign.
Okay. That's all, doctor. You can go to the next station now.
Okay.